Mr. Marty Bunagan. I am Michelle de la Serna and I will be your student nurse for today. How would you like me to call you?
Marty.
Okay. So Marty, for today we're going to assess your abdomen to check if there are any abnormalities or problems when it comes to your gastrointestinal or your abdomen. So, do you feel any pain today? When was your last bowel movement?
Early in this morning.
Okay. So, no abdominal pain right now? No stomach pain?
No.
Okay. So, shall we proceed?
We shall.
Okay. So, Marty, for this procedure to be more successful, we're gonna need you to take off your shirt, but we're gonna cover the areas that we won't be assessing. Is it okay with you?
Yes, it's
Okay. I have assisted my patient in a recumbent or supine position. His arms are at the side. I've exposed only the abdomen and covered the other areas which we're not going to assess. So as per inspection, there are no breaks in the skin, there seem to be no wounds, there are no scars or any indications of past surgery, there seem to be no redness, so everything looks good and normal. So now I am in eye level with the patient's abdomen. So the contour seems to be a flat stomach. The patient has a flat stomach. It is symmetrical, no visible presence of lumps nor nodules. So Marty, would you inhale for me? And exhale. Inhale. And exhale. So the movement of the abdomen is outward and normal, and the abdominal muscles contract and relax with respiration. The patient's aortic pulsation is quite visible above the umbilicus and it is normal pulsation. Also, there are normal vascular patterns. It appears to be faded into the skin and no abnormalities as per my inspection. We're now going to proceed to auscultate our patient first. We're going to auscultate first before we palpate and percuss so that we do not alter the bowel sounds. We're going to start at the right lower quadrant and go clockwise. So we're going to first warm our diaphragm. Marty, I'm going to put my stethoscope on you. I want you to just relax for me, okay? Okay, so we're going to start here. We should hear around 5 to 30 sounds per minute. So listen for at least a minute per quadrant. Okay, so there are at least 5 to 30 sounds per minute. If you hear no bowel sounds, we have to listen for 5 minutes. We should hear clicks and gurgles, and occasional borborygmus or loud prolonged gurgle may be heard in those 4 quadrants, which is normal. Now we're gonna check for vascular sounds using the bell of my stethoscope, and we're gonna start with the aortic, which is just below the xiphoid process. So it's normal to hear blowing, swishing sounds. Then to the right venal artery, it will be to the right below the aortic artery. Then to the left. Now we're gonna go to the iliac artery. It's just below the belly button, a little to the right or to the left. So, the right iliac and the left Okay. So all sounds elicited were normal, and there were no abnormal sounds elicited. There is no need to auscultate for the femoral artery, as there was no presence of any bruit sounds, as we auscultated the aortic right and left renal artery and the iliac arteries. So we're now gonna percuss our patient. We're gonna do the same technique. We're gonna start from the right lower quadrant, following a clockwise manner. So mainly we're gonna hear a tympanic sound over the abdomen. So all is normal, and as we heard, it was mainly tympanic sounds. Okay. So now we're gonna do the fluid wave test. So I'm gonna ask my patient to place the ulnar side of his hand on the umbilical area. So Marty, could you please place your hand over here? I want you to apply a little pressure. And I'm gonna put my other hand on the flank, and the other side, we're gonna tap it with our fingertips, and we're gonna have one side feel the transmitted impulse from the other flank. Okay. Now we're going to percuss our patient's liver. We're gonna start from the diaphragm. And we're gonna go ahead and percuss until we hear a dull sound. So we're gonna mark it with skin-safe markers. Okay. And then we're gonna start percussing from the right lower quadrant, moving upward till we elicit a dull sound again. This will mark the liver. So we're gonna mark it again. And we're gonna measure this length. So the normal length should be around 6 to 12 centimeters and 3 to 4 centimeters in the umbilical region. Now we're gonna palpate the abdomen of the patient. We're gonna first do light palpation. So Marty, I'm gonna palpate you, and I want you to tell me if you feel any pain as I palpate your abdomen, okay? So we're gonna do the same manner. We're gonna start from the right lower quadrant. So we're gonna feel for any masses or lumps. Tell me if you feel any pain, okay? Now we're gonna do a deeper palpation. So tell me again if you feel any pain, okay? I'm just gonna put a little more pressure. Do you feel any pain?
No.
Okay. Now we're gonna do the bimanual technique to assess deeper organs such as the liver and the spleen. Tell me if you feel any pain, okay? Okay, so patient did not complain of any pain, nor were there any masses or lumps as we palpated the patient. So it is normal. We're now going to palpate for my patient's liver. We're gonna start at the right lower quadrant. So I want you to breathe in as I palpate you, okay? So breathe in and out. In and out, in and out. Okay. This one. Now we're gonna use the bimanual technique. We're gonna use 2 hands now. I want you to inhale again and exhale. Inhale and exhale. Inhale and exhale. Okay, so inhale and exhale. Inhale and exhale. Did you feel any pain as I touched you?
I didn't feel anything.
Okay. Now I'm gonna palpate for my patient's spleen. I'm gonna put my left hand around and under the left lower rib cage, and I'm gonna press down on the left costal margin with my right hand. So Marty, I want you to breathe in. Okay. So palpate it as the patient takes a deep breath. Okay. Exhale. Inhale again. Okay. So the spleen seems to be normal and there were no masses or swelling or enlargement of the spleen. So now we're going to palpate my patient's kidney. So we're going to start off the same manner as what we did with the spleen, but this time my left hand will be under the patient's body between the rib cage and the iliac crest. So I'm going to palpate with my right palmar surface. Okay, so right to the umbilicus. And Marty, I want you to breathe in again. Okay, as we palpate. Okay, and out. And in. And out. Now we're going to palpate the other side. We're going to do the right side now, and I'm going to do the same technique with my hand, my left hand under, and I'm going to use my right palmar surface to palpate. So take a deep breath in for me. And out. And in. And out. So, okay. Normally, kidneys are not palpable if they are in normal shape and normal size. A kidney might be palpable if it is enlarged. So did you feel any pain as I palpate?
I didn't feel anything.
Now we're gonna proceed to doing the fist or blunt palpation on the patient's kidney. I've covered the front or anterior thorax of my patient. So let's proceed. I want you to tell me if you feel any pain, okay? You feel any pain?
No.
Let's proceed to the other side. So I want you to tell me if you feel pain again, okay? Did you feel any pain?
No.
Okay.
Genitalia and rectal assessment. A dummy was used in the following clips and they are not my clips. Position patient in supine position. Let patient bend their knee up and put their heels together and relax their knee outward as much as possible but still comfortably. Gain consent to expose the area. So there seem to be no discoloration. Mons pubis and vulva is normal. There is no swelling, induration, pain or discharge from Bartholin's gland. Clitoris is in normal condition. The external genitalia is normal. There are no abnormalities. Patient should be in a standing position. As per observation, there are no nits or lice at the base of pubic hair. When we palpated the shaft, there was no tenderness, swelling, masses, or plaques. Urethral meatus is in normal position, normal color, and there were no discharge. As we inspect the scrotum, there are no lesions, inflammations, nor swelling. There were no complaints of pain. There were no masses as we palpated the scrotum. Remember to educate the patient when it comes to genitalia examination on their own. Gain consent to expose the area. As per assessing the rectum and anus, there were no nodes, tenderness, inflammation, and rashes. When we inserted the index finger into the canal, there were no tenderness nor nodules. Even after inserting the finger further, overall, there were no irregularities, no masses, no swelling, no inflammation, or any complaints of tenderness.
Marty, after assessing your abdomen and your gastrointestinal, it came out as normal. So all tests and all assessment came out as normal. There were no problems, and per inspection, there were also no problems. So, okay, thank you so much.